Okay, let's speak now to Eric Feigl-Ding. He is a senior fellow at the Federation of American Scientists, and he joins us now from Washington. Thanks so much for being with us. Okay, the plans are in order, but still, a significant proportion of the public really remains to be convinced that these vaccines are safe. Are you worried about how much that could affect, the overall rollout?
Yeah, that is a serious concern because there's a saying in vaccines. It's not the vaccines that ultimately saves lives, it's the vaccination programs. And you can have a 100% effective vaccine, but if only 50% take it, you have a 50% effective vaccine. And so I think countering misinformation, also the shipping and the storage, as you mentioned, is a key issue, but also reminding people to get the second dose. And logistically, that's very tricky in some parts of the world, even in the US, where we don't have a centralized medical record system. And furthermore, I think there's more vaccines on the horizon that could be even better. Like Johnson & Johnson is a single dose, non-freezing required vaccine. So I think there's many vaccines that's on the horizon, but in the meantime, there is lots of challenges. And they're doing the AstraZeneca trial just to be safe one more time in another group of people just to confirm.
Okay.
So I think we want to reassure the public.
I gotta bring up something you mentioned there, and that's, in the United States, you said they don't even have a central database on vaccinations. So if we're talking about a global pandemic, and for example, China saying anyone that wants to, travel abroad, you will have to get vaccinated as a priority if you're going to leave the country. If we start seeing some of those vaccinations on that level become mandatory, the whole world is going to need a database because, for example, we have to get the yellow fever vaccination to travel to countries in Africa. You're given a little booklet. If you lose that booklet, how do you go about proving that you actually had the vaccination?
Right, and this is actually the point of discussion of whether we should have a vaccine passport that is universally recognized either within a country or between countries. Because there's so many different vaccines, and did you get the second dose or not? And how do we actually show when you're traveling or attending a concert or any venue that might require these high security, you must be vaccinated proof? And that proof is very difficult because, some countries like US don't even have a single system, but other countries like the UK and Sweden may have universal systems, but you have to prove it to the world. And that proof is a huge bureaucratic burden as well, especially if we want to reopen businesses and the businesses and countries will require them.
Right. I mean, okay, I don't want to dwell too much on it, but doesn't that have to be addressed as quickly as possible if we're looking at the rollout starting in weeks, months at the latest, really?
Yeah, absolutely. I think in certain ways, international coordination on a vaccine passport might be a little bit tricky, but I think each country will have to create their own national identity card that you've been vaccinated. I think it's something that's definitely on the horizon, but it's a very, very logistically difficult to roll out, and especially with so many vaccines on the horizon.
Okay. Now, before that, actually, I need to ask you, who do you think, once the vaccinations, the doses are put onto the general market, where would you like to see the vaccinations prioritized?
Well, healthcare workers, I think everyone agrees healthcare workers should definitely be vaccinated. And then there's a debate. There are some who say vaccinate the nursing home residents, the highest risk groups, people with pre-existing conditions. But then there's another argument, well, technically it's the young people and middle-aged people who spread it the most. And we've seen that in the data. It's often young people who are spreading it to the elderly. So therefore you should vaccinate them. I think that it remains to be debated, but I think essential workers, fire, police, other workers that have to work every day. And I think we should do a balance between the high-risk nursing groups as well as these everyday people who are spreading them at a much higher rate than any other population.
Just really quickly, Eric, I wanted to come back to the public confidence issue that obviously concerns you. We've heard now that, leading politicians, particularly in the United States, say they will be among the first to take it if that's what's necessary to gain the public's confidence. Do you think those are the kinds of measures that help?
I think they definitely will help because, look, if rich and wealthy and famous people take it, they would not risk their lives for something that's dangerous, would they? I think it's really key that celebrities and people that they trust, but not necessarily celebrities, it could be church leaders, whoever the local community respects the most. If they can be the vanguard and show the world it is safe, then I think that actually bodes the most public confidence for local communities to get vaccinated, especially minority groups.
Eric Feigl-Ding, great to talk to you. Thanks so much for that. We appreciate it.